Hi, my name is Dr. Beth Gaida, and I'm one of the obstetrician gynecologists in the Women's Center at Door County Medical Center. Our goal is to provide you with a lot of information so that you can prepare for your upcoming delivery so that you have a great experience for both you and your baby.
Hi, my name is Julie, and I'm a labor and delivery nurse here at Door County Medical Center. This video is designed to provide you with information regarding the C-section delivery of your baby. We know that when moms are well prepared for the delivery and birth of their baby, they'll have more realistic expectations for the birthing experience and what it will be like, and they'll encounter less anxiety and stress throughout their hospital stay, and they'll make a better and faster recovery after their birth. The nurse in the Women's Center will give you a guidebook that will help you prepare for things that you can do at home before you come in for the birth of your child, like preparing meals at home. You can also pack an overnight bag with things that you'll need while you're here in the hospital for you and your baby. Things like a camera, your cell phone, and extra long chargers are a great idea. Also a great idea to install your car seat before you come to the hospital so that that's all taken care of. Also be aware that you will not be able to drive your vehicle for an extended period of time after you get discharged with your baby. So making plans for someone to be able to take you to the hospital for your appointments and for baby's appointments is also a great idea as well. See the C-section guide for information on restrictions for things like climbing stairs or different other physical activities. That way you can plan it best for how to navigate your home when you get home. Prior to the day of your delivery, you'll have labs drawn 72 hours before your planned C-section. At that time, we'll place a blood band on your wrist. We'll need that blood band to stay on for the entirety of your hospital stay. So it's okay to have things like a shower, but please do not submerge that wristband into water or take a long bath after we place that band. At home on the day of your delivery, please do not shave anywhere in your bikini area, as that increases the chances of infection in that area. We also ask that you please do not wear any nail polish or makeup, and remove any and all jewelry and leave all valuables at home. Restrictions on eating will be found in your C-section guide and will be gone over with you with the Women's Center nurse. You're going to find the location of where to come into the hospital on your C-section appointment list. You'll either be coming in the main entrance, that's door number 1, or the ER entrance, that's door number 7. At the birthing center the day of your delivery, you're going to come in and we will get your vital signs. We'll also get you changed into a gown. We'll then put on some fetal heart monitoring and we'll listen to baby's heartbeat and see if you're having any contractions. We'll also start an IV and get IV fluids running at that time. We will also clip any hair in your bikini area if needed for the surgery. At that time, the OR team will come in. That includes the anesthesiologist, the OB doctor, pediatrician, OR nurse, and you'll have already met your labor and delivery nurse. Your OR nurse will walk you down to the OR suite where you'll sit on the edge of the table as they get the anesthesia placed. They'll have you lay back on the table and we'll listen to fetal heart tones one more time, make sure baby's doing good before they begin to scrub your belly. At that time, they'll set up the draping. We'll bring in your labor support person to sit at the head of the bed next to you, and they will begin scrubbing your belly, and we'll also place a bladder catheter at that time as well. When everything's ready, they will make a small incision into the bottom of your stomach and then in through the uterine cavity, and then shortly after that, your baby will be born. We will then clamp the cord and baby will be brought over to the warmer where it will be evaluated by a pediatrician and a labor and delivery nurse. We can then invite your support person to come and cut the cord a little bit shorter if they so wish or choose to. Baby will then be swaddled and will be brought to the head of where you are, up to your head. Baby can be held either by the labor and delivery nurse or by your support person, whatever you choose. Your placenta will then be removed and the incision will be sewn up. It's at this time that we really encourage family bonding, and that's when the newborn will be brought to you. Once the operation is complete, we'll be brought back to your room via your bed. and your spinal anesthesia will last approximately around 3 hours. Your recovery period is about 2 hours. Depending on your medical condition, it could be a little bit longer. It's at this time that we do not allow any other visitors other than your labor support person. And at this time, we strongly encourage skin-to-skin time and breastfeeding if you so choose, and we call this time the golden hours.
As with any surgical procedure, there are risks associated with C-sections. These consist of 4 main categories: the risk of infection, risk of injury to intra-abdominal organs, the risks of anesthesia, and the risk of blood loss. The risks of anesthesia are generally discussed with you the day of surgery by your anesthesiologist. However, we have you stop oral intake at certain designated times based on the timing of your procedure, which will be discussed in detail with you by the OR personnel 1 or 2 days prior to your scheduled C-section. The risk of infection is something that you have a key part in helping reduce by using the antibacterial wipes the night before surgery and following the detailed instructions that we will give to you in a printed off format. We also give you a dose of antibiotics preoperatively and obviously clean the abdomen off with a surgical prep prior to initiation of the surgery. As always, if you are having concerns postoperatively about postoperative infections, you should not hesitate to call one of the various numbers that you'll be provided at the time of your discharge. Risk of injury to intra-abdominal organs is another risk associated with surgery. C-sections are a little unique in that the pregnant uterus pushes many of those organs to the side and behind the uterus. The main organ that we worry about is the bladder, which is at the lower part of the pregnant uterus, and this is why you have a Foley catheter inserted after your spinal anesthetic is in place. If there's ever a concern for risk of injury to the bladder or the ureters, which are the tubes that drain from the kidneys to the bladders, we will not hesitate to get a specialized surgeon involved to help us assess the situation. Additionally, in the rare case of a bowel injury, which is much more common in women who have had several intra-abdominal surgeries prior to the C-section, we would not hesitate to get surgery involved to rule out an injury and, if necessary, make a repair. Risk of blood loss is increased anytime you have a baby, whether vaginally or by a repeat C-section or scheduled primary C-section. It is rare for us to have to give blood intraoperatively, but that is something that is a possibility. If you have any religious concerns about not getting blood or other concerns, you should discuss these with your surgeon at the time of your preoperative visit or the day of your scheduled surgery. There are many alternatives that we can use instead of giving blood in those situations. Most times when we have to give blood, it involves a conversation between your surgeon and yourself, usually on postoperative day 1, where you're having significant symptoms related to your postoperative anemia, and we decide together whether or not to give blood. Obviously, that's a conversation that varies from patient to patient and in different circumstances.
You will be meeting with the Women's Center nurse at around your 36-week appointment. The nurse will briefly review the information in this video, and she'll also give you your C-section guide and your additional list of appointments. The Women's Center nurse will be happy to answer any questions that you have. Always feel free to contact the Women's Center or the Birthing Center if you have any questions. We're always there for you. Thank you for choosing Door County Medical Center as the place for your delivery. We are honored and privileged to care for you and your baby.
On behalf of Dr. Dempster, the nursing team, and all the staff here at Door County Medical Center, we want to thank you for choosing to have your baby here with us. It is truly our privilege to care for all the women and babies in our community.